Bismillahirrahmanirrahim. Simple diffusion is consists of convective transport, acid-base diffusion, and third one is ion pair transport. In this special type of simple diffusion, the transport of charged drug occur such that the charged drug forming complex with other charged endogenous molecules and forming a complex. Let's suppose this is a drug with negative charge. This is the charged molecule with positive charge, and this negative positive forming a neutral complex. Now, if this neutral complex having appropriate partition coefficient, so it will easily cross the cell membrane, and inside the cell the lysosome will break this complex and the drug is free and molecule is free. So if the molecule is having suitable partition coefficient, so it can absorb, go back to take up another drug molecule. This mechanism is suitable for the drugs which are charged or ionized and that can maintain their charge at all physiological pH. That is, if the drug is having a resonating or any basic concept of organic chemistry through which they can maintain stable itself. अगर किसी ड्रग में रेजोनेंस है, इंडक्टिव इफेक्ट है, हाइपर कंजुगेशन है, तो इसके थ्रू ये चार्ज ड्रग अपने आप को स्टेबल रख सकते हैं. तो ये complex formation with ion is for those drugs which can stabilize itself in charge form. Second possibility, the drug form a complex with endogenous material such as hexyl salicylate or oleic acid. The drug form complex with endogenous substance which are highly ionized. Now that drug and endogenous substance complex, for example sulfonamides form complex with hexyl salicylate and propanolol form complex with oleic acid. Now this complex is get absorbed through cell membrane, and inside the cell again there is breakage of the complex bond. Now the drug is free inside the cell and the endogenous substance is free to reabsorb back and carry another molecule. Thank you for listening.